We're glad you came to Columbus Springs. We understand that this is a difficult time for you, and we want to make your stay as comfortable as possible. Most importantly, help is here, and recovery is possible. Today, you'll meet members of your treatment team, a physician or a nurse practitioner, a social worker or chemical dependency counselor, recreational therapist, as well as registered nurses and patient care assistants. You'll have a physical by an internal medicine physician to make sure we are treating all of your physical and psychiatric needs. You, along with your treatment team, will decide on your treatment goals. These may include things like returning to work or school or maintaining sobriety. Your therapist, also known as a social worker or counselor, will review your written treatment plan with you and discuss any questions or concerns you may have. Your psychiatrist or nurse practitioner will determine a medication regimen that is unique to you. Nurses will administer these medications through the safety guidelines determined by the FDA, medical staff, and the pharmacist. If you have questions about your medications, please discuss them with your treatment team. Safety is of utmost importance to us. When you are admitted, we will conduct a thorough search of you and your belongings so that everything brought on the unit is considered safe. This is done with great respect to your privacy and any past traumatic experiences. Any item that we feel is unsafe will be locked away or sent home with your family until you're discharged. While this can be frustrating at times, we do this so that we can maintain a basic level of safety among all patients. Items that we must confiscate on admission include, but are not limited to, cigarette lighters, belts, shoelaces, and toiletries that include sharp edges or contain alcohol. You may be able to check some of these items out during limited times on the unit and with supervision. Patient care assistants conduct rounds on a regular basis to assure that you and other patients are safe. Because we know that it can be overwhelming to make this many life changes at once, we do allow smoking at Columbus Springs. Smoking times occur at 6 predetermined intervals throughout the day. If you are a voluntary patient, you may go outside during these times and smoke. Your recovery is primarily based upon the work you will do in groups, so breaks are timed around the group schedule offered here at Columbus Springs. Rarely is a patient discharged in just a few days, as a crisis situation often takes time to stabilize. The most successful patients remember to take recovery one day at a time. During your stay, you'll be invited to participate in the therapeutic groups that we offer, which can really help you on your journey to recovery. The most successful patients take advantage of the many treatment options available to them. Our caring team is trained to meet your needs throughout your stay. Should you choose to leave treatment prior to completing your inpatient treatment plan, your provider may choose to make the discharge against medical advice, or AMA. We care about your safety and have an ethical obligation to keep you safe. If the team does not feel you can maintain safety after discharge, they may pursue a legal option called probate. If you find yourself in this situation, your therapist, nurse, or provider can discuss the process with you at length. This is why it is important to work closely with your treatment team so that you will get the help that you need. At the time of discharge, you'll be asked to complete paperwork, including a patient satisfaction survey. We strive to score a perfect 10. In order to do so, we need to hear from you during your stay. Let us know what would keep you from giving us a 10 so we can improve your experience while you're here. Your feedback is very important. We use it to provide you with the best care possible. Your success in recovery is highly dependent on your plans after discharge. With your permission, they may involve your family or other loved ones to support you in your recovery. Our interdisciplinary team works to assure that you have the comprehensive, unique plan that you need. Your therapist will work closely with you and your family to finalize your plans upon discharge and will answer any questions about next steps. There's a lot of information that can be difficult to remember, so our team members are happy to answer any questions you have along the way. We have nursing and PCA staff here 24 hours a day. Most importantly, we want you to focus on yourself and your recovery. Typically, the day after discharge from our inpatient program, you will begin our outpatient PHP program. This program lasts 2 to 3 weeks and is more than 20 hours a week of intensive group therapy that even includes Saturday programming for you and your family and friends. Please ask about all of our outpatient options to ensure success in your treatment goals. Throughout your time with us, keep in mind, we are here to help, and no matter how dire your situation may seem, we know you can do it. There's hope, help, and recovery at Columbus Springs.